There may be tons of information about the coronavirus out there, but it can be hard to find without one place to go for all of it. So filling that gap is a San Francisco-based company called Datavant. Their crew has created a COVID-19 database. Plus, they've hosted a hackathon to encourage new ideas from medical professionals on how to slow the spread. Joining us now is Bob Borick of Datavant to better explain the work that they're doing. Hey there, Bob.
Hi, thanks for having me.
Thanks for being here. So let's start first with what Datavant is and how have you guys been redirecting your efforts since the outbreak?
Yeah, so what Datavant does is connect health data. That's the company's mission. In the ordinary course of business, what we do is help bring together disparate health data sets to answer big analytical questions, from how you more effectively recruit patients to clinical trials to how you identify rare disease patients that might be misdiagnosed or not properly identified. And as the coronavirus hit and became increasingly serious around the world, we spent a lot of time internally thinking about what we could do to help. And by virtue of what we do in the ordinary course of business, we have strong relationships with a large number of health data sources and some of the best health analytics companies in the country. And so tried to use that network to bring together this coalition and create this research database.
So you're a private company that's working with both public and private sectors to gather information on COVID-19, is that right?
That's correct. This particular effort is entirely pro bono. There are over 20 companies that are now contributing to the effort in different ways, from contributing data to contributing technology to contributing additional resources. Everyone is doing it for free, and the goal is to make it available for academic and medical research around the country.
So who are you asking to submit, and what kind of details are you looking for?
Yeah, so there are a number of different data types that are of interest to researchers today. Right now, we have sources that are contributing medical and pharmacy claims data, electronic health record data, some basic demographic data, and mortality data, which unfortunately is very relevant in this crisis. All of the data is de-identified, but that allows researchers to answer questions like, what are the different demographic factors that seem to be driving different outcomes in patients around the country? What are both drug and non-drug treatments that physicians are being forced to prescribe off-label without a lot of information about their safety and efficacy? What can we learn from looking at electronic health record data to get an early signal about whether or not some of those things may be safe and effective?
So once you gather all of that information, how do you hope that this will help people in battling the pandemic?
Yeah, so today one of the very basic challenges that healthcare workers in the field have, and researchers have, and patients have, is that everyone is operating with extremely limited information. So healthcare workers on the front lines today are being forced to make life and death decisions without a lot of information at hand to support those decisions they're being forced to make. I think for everyone in the health data and health technology community, what we want to do is come in and support everyone who's operating on the front lines today and make it as easy as we can to get access to good information quickly. There are today hundreds of clinical trials being run around the world looking at potential treatments and therapies for COVID, which are essential and will remain the gold standard. But in the interim, there's a large amount of real-world data that's being connected every single day, and our goal is to bring it together and allow people to start learning from that as quickly as they can, so we can better understand how to mitigate the course of this disease.
So this is HIPAA compliant in that you take away the identity from the medical records that you're receiving from all kinds of healthcare medical facilities, and then you gather the data. And what kinds of information can we receive from it?
Yeah, so the entire environment's HIPAA compliant, and above and beyond HIPAA compliance, we've tried to put in place very aggressive safeguards and controls to ensure the ethical use of patient data. So no researcher is ever even provisioned access to the environment until they go through multiple layers of governance review, including privacy review and review with the scientific steering committee, before they could ever even look at any de-identified data in the first instance. And the questions that we hope people will be able to answer are, what are the comorbidities? What are the different factors that drive responses to the disease one way or the other, positive or negative? So the different questions people are trying to answer today can range from what are the different demographic factors that lead to positive or negative responses as the disease progresses. What are some of the medications that are being used in the ordinary course of care, or in this instance, maybe prescribed specifically off-label? And by looking at real-world data coming in from electronic health records and other sources, we hope that researchers can better understand the safety and efficacy of those medications while clinical trials are still being stood up and run.
And I also want to talk about how Datavant hosted a hackathon recently aimed at identifying and fostering creative solutions to this pandemic. There were a few that were chosen from hundreds that applied, and we're going to play some video for you guys of some examples, something like the inflatable field hospital, and then another that would let people know where supplies are in stock around them. What can you tell us about the results from that hackathon?
Yeah, so the hackathon, the initial motivation was that if you look around and try to find the silver lining in this pandemic, I think there is an incredible spirit of cooperation and volunteerism and people who want to find a way to help, including in the technology community. The most overwhelming thing about doing the hackathon to me was how many people very quickly emerged to come in and participate on top of their day jobs and other responsibilities. They readily signed up to spend 3 days with us, working 24/7 through the course of a weekend to try to stand up different applications and data dashboards and analytical tools to help better understand this disease. So in the space of a week, 2,000 people registered for the hackathon. We received over 200 project submissions and are still in touch with some of the teams that we spotlighted today to help them get those ideas into production and get them used in the real world.
And so before I let you go, how can people access information that you guys are now providing in this database?
Yeah, so the website is COVID-19 researchdatabase.org. I encourage you to go and have a look. If there's anything that you can contribute, there is a space on the website where you can fill out your information and offer to make a contribution. If you're a researcher or an analyst who would like access, there's a place to apply as well.
You're watching Chron On, the Bay Area streaming news 24/7.